Good afternoon. It is now March 12, 2024. I'm Dr. Deuk Majan at Deuk Spine Institute, and I'm here with Dr. Davis and Luis and the rest of the team. This is our last case for the day. This lady is having back pain on the left side. It is around the L3, L4, L5 region, and I believe when I exam, she has pain coming from the facet joints, F-A-C-E-T joints, which are in the back of the spine. She has pain at L2-3, L3-4, L4-5. So we're going to cover those three facets with a procedure called a rhizotomy. Rhizotomy is the best treatment in the world for facet joint pain at this time. It is quick and efficient and safe, and if it's done properly, the Deuk plasma rhizotomy way, it can be permanent. So we're going to get started. Are you ready, doctor?
Yes.
The first thing we're going to do is we've already positioned, prepped, and draped the patient. We're using our x-ray machine to localize and navigate down to where her pain is. So let's go ahead. We're going to give her some more numbing medicine. Shot. All right, you can see the needle is at 543. We need to be a little bit more north, all the way up at L2. And I can already tell you there's a lot of scar tissue. I can feel it. All right, so 5432. Shot. I'm making my way up. You guys see the needle tip right there, Dr. Davis?
Yes, sir.
That is the pedicle of 2. You agree?
Yes,
Luis,
sir.
Jordan?
Yes, sir.
Yeah, Jordan, you agree? 2, and then down below 3, and then 4, and then 5, and then S1. So we're at L2, and we're going to give some numbing medicine, and then I'm going to make an incision. I'm going to use a probe. My probe is going to basically burn, cauterize, destroy the pain nerves that are found here that are causing her pain. So I'm making my incision. It is a 4 millimeter incision. That's all we need to get the probe in. The probe is around 4 millimeters wide, and this procedure is a newer procedure. We've patented it with the United States Patent Office, and the procedure basically is a new way of doing a rhizotomy that has never been done before. It's percutaneous, just like an RFA, and it's minimally invasive, just like an RFA, but the difference is that we're sweeping our probe tip and we're cauterizing the nerve, cutting it in half. That nerve we're talking about is called the medial branch of the dorsal ramus. Shot. All right, so I'm aiming for that target. I'm a little bit too lateral. I'm going to come back and go more medial. I can feel the scar tissue. Shot. I'm a little inferior, so I want to go more superior. Superior means towards the head. All right, so that's looking almost perfect. You agree, Jordan?
Yes, sir.
All right, I want to feel the bone. I'm not feeling the bone just yet. Shot. I think I'm too low. So the key to doing this procedure is to find that pedicle and then to go just lateral to the pedicle. Shot. Which is kind of where I'm at right now, but you've got to feel the transverse process. There it is. I feel the transverse process. Come on in, Dr. Davis, and just push down. You could feel the resistance of the bone there. And you don't normally feel that if you're in the soft tissues. Okay. All right, so double check. There we are. We're right at the junction of the transverse process and the superior facet of L2. And that's where we want to be. That's the perfect spot. I'm moving around a little just to make sure. 2, 3, 4, 5, 1. All right, that's one down. Go ahead and feel the grinding on the cortical bone right there. You won't hurt anything if you just slide it back and forth a little. You feel it?
There.
Right here, here. Just go in and out a little bit. Feel the grinding?
Feels like it's
Like
more
sandpaper. All right, now we're going to go to the next one. Shot. All right, 2 lateral. I need to be more medial. Shot. 2 superior. And there it is. I feel the bone right here. I'm literally dancing on it. Let me have that. I'll show it to you in a second. Shot. So you want to be right on the TP, and we are. All right, now take that and just up and down, and you can feel you're right on the TP. You feel that?
Mm-hmm.
Now you know you're in the right spot because on the
Feel the groove.
yeah, you can even feel the groove, right? So perfect. Let's take a shot. You can see the transverse process. I'm literally exactly where you want to be. It doesn't get better positioning than that. Not even Dr. Patel could do better. All right. So I'm doing the Deuk plasma rhizotomy to treat her facet pain. Shot. This is again a new technique that was developed here at Deuk Spine, and we've had great results with facet pain and SI joint, and even with knees and hips and shoulders. Unfortunately, we're going to have a lot of pushback from the orthopedic surgeons because they make most of their money doing hip and knee and shoulder surgery, replacement surgery. So they're not going to be happy with us. But in the end, we want the patients to get the very best that's available, and that's what we're offering. So we can now get rid of chronic knee pain from arthritis, chronic hip pain. See that exactly where the tip is? You see how you follow the transverse process? Show them the TP. Right there. That's the top. That's the bottom of the TP. Show the top of the TP. Start laterally there, and now come medial. That's the top of the TP, and right there it bends up and goes to the superior facet. That valley right there is exactly where we want to be. That's where that bad nerve is. Lay still, you're doing great. We're almost done. One more to go. Shot. I got to get down to 5. So that's a little too low. And we use our x-ray machine to guide. Shot. So you see the pedicle of 5. Show us the pedicle of 5, Jordan. That's right. Shot. We want to be just to the side of that, just at the top lateral. I can feel it right here. Hold on. I'm trying to get there. Let's see where we are. Shot. All right, we're right over the TP, but I'm not on it, so I have to feel it. I won't discharge the energy until I know for sure we're right on top of it. All right, I'm feeling bone here. Let's take a look and see where this is. Shot. All right, that's too inferior. I want to be a little more superior. Shot. That's better. I'm still not happy with it though. This feels good right here. Shot. That shows we're right at the tippy top. That may even be facet. I want to be a little bit further down. Deeper. Shot. Well, that's got to be it right there. It feels like the transverse process. That's right where this nerve would be. Remember, we're not killing the nerve going down her leg. We're killing the nerve to the facet joint called the medial branch of the dorsal ramus. And that's it. We're done. Thanks, everybody. Good job. Hopefully that takes care of the problem. So look at this, folks. It's a 4 millimeter cut. Let's bring out, do you have it measuring or no? You don't need it. Don't worry about it. Everyone can see it's small. So are we going to do a staple?
Yes.
All right. We're going to put a staple here.
That's perfect. Yes.
This is a protective band, by the way. I'm not peeling her skin off. I remember the first time I saw a surgeon take that off. I need a mosquito. I accidentally put the... well, actually, you know what? That is pretty good right there. I'm going to just do 2 of them. I don't need the mosquito. All right. Good job, Luis. Thank you. Dr. Davis, thank you. Yes? Dr. Berndes, thank you. Any questions from the audience?
No current questions.
All right, so we just destroyed the medial branch to the dorsal ramus to the joints at L2, 3, 3, 4, 4, 5 on the left side, which is where she was getting her pain. She has a bad disc, a severely degenerated disc, but I don't think that's causing her pain. And this is a much quicker and safer treatment. Great job, everybody. You can go ahead and end the broadcast.